I'm Nancy Harthun, and I'm a vascular surgeon who works in our Fort Wayne office, Indiana.
Can you please tell us what vein stripping is?
Vein stripping is a surgical procedure that's been around for a fairly long time. It was one of the first ways we developed to be able to treat significant venous insufficiency. And the way it's performed is a small incision is made at the ankle where the greater saphenous vein is reliably found. A small nick is made in the vein and a plastic catheter is inserted in there. To do the next part, the patient has to be asleep. There's no way that you can get that area numb enough to actually remove the vein in this way. So almost by definition, vein stripping was performed under general anesthesia. So you cut the vein in two at both ends and tie it off. The plus side is it does separate all the branches off the saphenous vein. The downside is it makes a fairly big tunnel, like that whole course is sore and inflamed for a while. And when I performed these, I would squeeze all the blood out of the leg and put a tourniquet on the top to reduce the bleeding when all those branches were severed. But a lot of people did not do that. So you would end up with a significant amount of bruising at the end of that. So a lot of people did not enjoy it. It was certainly more of a commitment. They had to come to a surgery center or hospital center to get the general anesthetic. And, you couldn't drive yourself home. It certainly wasn't strictly outpatient. You needed a ride. And it was more invasive. There's no question it's more invasive.
Is vein stripping obsolete?
I'm going to take one small step back from calling it obsolete. I think it has largely been replaced by new technologies that are much better. I would reserve vein stripping for one clinical scenario, and that's when a patient has a venous aneurysm in the greater saphenous vein. So this is a vein that is about the size of a golf ball or bigger. Normally, it should be about the size of a pencil. So you can understand that that's almost 2 times as big as it should be. Aneurysms can allow large clots to form, and if it's close to where the saphenous vein meets the deep system, if that clot breaks off, it could have significant health consequences. But I think that is an effective way of dealing with a greater saphenous venous aneurysm. Now, those are quite rare. So again, I will use the phrasing, stripping has been largely replaced by our better technologies, but it is nice to have some of these techniques in the rare circumstance where we're dealing with a venous aneurysm.
What technologies have replaced vein stripping?
The ways we currently use to shut down the saphenous vein are either heat, by inserting a heated probe in there that has either radio frequency or laser heat. There were mechanical ways of disrupting the vein that were not as effective, and most people are not using that right now. We also have a technology where you can glue the vein closed, and the benefit for that is that you don't have to inject numbing medicine to insulate the heat that you would transfer to the vein. But all of those technologies are done with a single needle stick and can be done between 10 and 30 minutes in an outpatient setting with no general or even sedation anesthesia. We can do that all with, at most, local anesthetic, or with the glue scenario, we don't even need to use the local anesthetic around the vein. And they don't need to be done in a surgery center with an anesthesia team.